On March 15th, the Centers for Medicare and Medicaid Services sent a letter to states with what they called essential reminders as the states are going through Medicaid unwinding. The purpose was to remind states of some of those prohibited practices when they're going through their redeterminations of people's eligibility for coverage. And the purpose was to make sure that eligible individuals kept their Medicaid. The feds were concerned that too many people were losing coverage. They gave about 10 examples of operations and processes that were not permitted. A couple examples of those include terminating a member too soon if it was the member who turned their paperwork in time, but the state was taking too long to process it. Other examples of processes not permitted: do not terminate Medicaid without first determining eligibility on other basis. Don't exclude individuals from administrative or ex parte renewals solely because of food share, food stamps, SNAP benefits, or other benefit program dates. And don't conduct administrative renewals at the household level. It has to be a person-by-person evaluation. Now, the Fed said this is necessary. It's the Kaiser Family Foundation that reminds us of the number of people that have been terminated to date. It's about 19.2 million Medicaid enrollees that have been disenrolled as of March 26th of 2024. About 31% with a completed renewal have been terminated, which leaves about 69% successfully renewing. 70% of people cut were for procedural reasons. Remember, those paperwork or computer glitch reasons, not because they're not necessarily still eligible. And children account for about 37% of the terminations. Now, only about 59% of renewals are administrative, and that means the state has enough information on you to do your renewal automatically. North Carolina is still leading the charge with doing the most automated renewals. The net change in Medicaid enrollment, for almost every state, it is a decline. There's one exception with the state of Hawaii. In the state of Wisconsin, about 310,000 people have been disenrolled, with about 600,000 successfully renewed. 66% of terminations are for procedural reasons, and 23% of renewals are administrative. The net enrollment decline is about 15.2%. You can read more on that data from the Kaiser Family Foundation. You can also read that full letter from CMS to the states. We link to both in the description below.